Bites and stings can be caused by a variety of animals, insects, snakes, or even humans. The most common mammalian bites are from dogs, cats, and humans. And each bite transmits the polymicrobial flora that can be found in the mouth, including Staphylococcus aureus, group A Streptococcus species, Klebsiella, Enterococci, Prevotella, and many more. Dog bites can transmit a gram-negative rod called Capnocytophaga canimorsus, which can cause gangrene at the bite site and can disseminate and cause sepsis, especially in asplenic individuals and those with liver disease. Cat bites or scratches, particularly from kittens, can transmit Bartonella henselae, which can cause cat scratch disease. Both dog and cat bites can also transmit Pasteurella multocida, which can cause cellulitis at the bite injury. Finally, human bites can transmit Echinella corridans, which is a gram-negative anaerobe which can cause local and disseminated infection, including being a cause of culture-negative endocarditis, one of the henselae organisms. In general, bite wound infections cause local cellulitis and in some cases can lead to a local abscess and fevers. Dog bites are the most common ones of all, and because dogs have strong jaws, they often cause serious tissue injury, but infections aren't that common. In contrast, cats have long, thin teeth that create deep puncture wounds, which very often get infected. Cat bites can even reach the underlying joint space, or periosteum, leading to septic arthritis or osteomyelitis. Like cat bites, human bites also have a high risk of infection. Most human bites happen due to aggressive play between children, but can also happen among adults. In a child, if the bite mark is over 2.5 centimeters in diameter, then it's likely an adult bite and should raise the suspicion of child abuse. The most common human bite occurs when a clenched fist hits a person's tooth, and that results in a laceration over the third and fourth metacarpals. Because of how close the joint spaces and bones are, septic arthritis and osteomyelitis are potential complications. Now, if a bite from any mammal, dog, cat, human, or otherwise, appears infected, a gram stain and culture of the wound should be obtained before starting antibiotics. If there are signs of systemic illness like fever or fatigue, then blood culture should be taken. Other labs include a CBC to look for leukocytosis and an ESR and CRP since they may be elevated. In a deep bite wound, an X-ray should be taken to look for foreign bodies like teeth, bone, or soft tissue injury, or subcutaneous gas. Management starts with controlling any active bleeding with direct pressure. The wound should be irrigated under high pressure with normal saline or tap water, and any superficial dead tissue should be debrided. The wound should be explored under local anesthesia to assess its depth and to look for foreign bodies. In general, primary wound closure is indicated for superficial dog bites. However, cat and human bites aren't closed, and instead should close on their own by secondary intention due to the high risk of infection. However, regardless of the biting mammal, a wound to the face should be closed because cosmesis is especially important. Now, when a decision is made to close a mammal bite wound, 4 criteria must be fulfilled. It must be uninfected, less than 24 hours old, not located on the hand or foot, and the individual should have a healthy immune system. Tetanus prophylaxis with tetanus toxoid and tetanus immunoglobulin should be considered. If the individual has received less than 3 doses or their immunization status is unknown, then both the tetanus toxoid vaccine and immunoglobulin are given. However, if they've received 3 or more doses of the vaccine, then the immunoglobulin is not given, and the tetanus toxoid vaccine is given only if the last dose was 5 or more years ago. Now, if the attack was from a wild or stray animal, then rabies prophylaxis with the rabies vaccine and immunoglobulin should be considered. If the individual was not previously vaccinated, then both the rabies vaccine and immunoglobulin are given. But if they were previously vaccinated, then only the rabies vaccine is given. If the bite wound is infected, oral antibiotics like amoxicillin clavulanic acid can be used to cover dog, cat, and human bites. Deeper or more serious wound infections may require IV antibiotics, like piperacillin tazobactam, and abscesses are incised and drained. Next up are snake bites, which are particularly problematic in parts of sub-Saharan Africa and Asia, where access to healthcare and antivenom may be limited. The two main venomous families are the elapids, like corals, cobras, and mambas, and the vipers, like rattlesnakes and copperheads. In general, after a snake bite, there are local changes at the bite site, like erythema, swelling, and development of hemorrhagic bulla and tissue necrosis, as well as general symptoms like nausea, fatigue, and headache. Elapids are neurotoxic snakes, and their venom acts by irreversibly binding to the acetylcholine receptor. Symptoms include a rapidly developing descending paralysis, resulting in diplopia, difficulty swallowing or talking, as well as limb or even respiratory muscle paralysis. In response, analgesics like acetaminophen, NSAIDs, or opioids, as well as antivenom, should be given. In contrast, viper snakes cause direct cellular injury and are hemotoxic. Their venom alters the balance of the coagulation system, resulting in coagulopathy, which can cause gum bleeding, epistaxis, hematemesis, and hematochezia. Additionally, venom tends to spread through the lymphatics, so if the bitten limb has tender lymphadenopathy, then you know that the venom is spreading beyond the bite site. Laboratory testing may reveal thrombocytopenia, or an elevated PT, and a decreased fibrinogen. Additionally, the venom might be myotoxic, resulting in rhabdomyolysis. This leads to tender, weak muscles and dark red urine, and laboratory testing that shows an elevated CK level and an elevated urine myoglobin. Treatment is to not suck out the venom, even though that's still commonly believed. Instead, the key is local wound care, including cleaning the wound, analgesia with acetaminophen, NSAIDs or opioids, giving IV fluids, elevating the affected limb to prevent pooling of the venom, and giving a specific antivenom like Crofab. Application of a tourniquet or ice have not shown to have any benefit in preventing dissemination of the venom. Now, antivenom is usually derived from other animals like horse and sheep serum, so there's a risk of developing an allergic reaction to the antivenom. Now, itsy-bitsy spiders can also bite, and there's usually a papule, pustule, or wheal, but sometimes they go unnoticed. The brown recluse spider lives in the United States and parts of South America, like Brazil and Chile, and causes a painless bite that slowly causes local erythema. Over time, there's tissue necrosis and hemorrhagic blisters. In severe cases, there can be hemolysis, thrombocytopenia, and renal failure that develop within a few days of the bite. Treatment includes analgesia with acetaminophen, NSAIDs or opioids, and in severe cases, antivenom is given. Interestingly, the antibiotic dapsone helps alleviate the symptoms of a brown recluse spider bite, but dapsone shouldn't be given to individuals with G6PD deficiency because it can trigger hemolysis. Next up is the infamous black widow spider that's found all over the United States and has a distinct red hourglass shape on its abdomen. The black widow spider releases alpha-latrotoxin, a toxin that causes a massive release of neurotransmitters like acetylcholine and norepinephrine. This causes a red blanching target lesion at the bite site, severe muscle spasms, and cramping, especially of the abdominal muscles, and can cause cardiac arrhythmias like atrial fibrillation. The severe abdominal cramping and pain can be mistaken for peritonitis or another surgical emergency like appendicitis. Treatment includes analgesia with acetaminophen, NSAIDs or opioids, benzodiazepines like IV diazepam for the muscle spasms, and antivenom if there are systemic manifestations. Another one is the scorpion. In general, scorpion stings tend to cause severe inflammation at the site and can lead to systemic symptoms like fever, vomiting, diarrhea, and even cardiac arrhythmias. Potential complications of envenomation include hemolysis and rhabdomyolysis. Some scorpion species, like the Trinidad thick-tailed scorpion, can also cause acute pancreatitis. Investigations include a CBC to look for anemia from hemolysis, creatine kinase and urine myoglobin to look for rhabdomyolysis, electrolyte levels in case of vomiting or diarrhea, serum amylase and lipase for acute pancreatitis, and an electrocardiogram to look for cardiac arrhythmias. Now, Hymenoptera refers to stinging insects like bees, wasps, and fire ants. Here, the problem really isn't venom, but rather it's the immune system's reaction to the venom. In general, there are 3 types of possible reactions to these stings: a local skin reaction, an allergic reaction, and a delayed reaction. The local reaction includes irritation, itching, swelling, and redness at the sting site. In the case of fire ants, small red papules that evolve into pustules develop. The allergic reaction occurs due to mast cell degranulation and release of mediators like histamine and bradykinin. This results in diffuse itching, urticaria, and potentially even life-threatening anaphylaxis. The delayed reaction is a type 3 hypersensitivity response, similar to serum sickness, that usually occurs up to 10 days after the sting. Symptoms include fever, joint pain, malaise, and a urticarial rash. Treatment includes IV antihistamines like diphenhydramine to relieve the symptoms of the local reaction, and IM epinephrine in cases of anaphylaxis. As for serum sickness, IV diphenhydramine is given for the urticaria, IV NSAIDs like ibuprofen are given for joint pain, and IV corticosteroids like prednisone are used to blunt the immune system. And the sea is no safer. Stingers, nematocysts, and octopuses all possess venom. Stingers include stingrays, catfish, and sea urchins, which cause intense local pain along with general symptoms like nausea and vomiting. Treatment includes removing the stinger and immersing the wound in hot water for 90 minutes, because this helps break down the venom. Now, the most common nematocyst is the jellyfish, and its sting causes intense local pain. Although it's commonly thought that urine helps reduce the pain, it doesn't. Instead, it's important to immerse the wound in 5% acetic acid, or vinegar, which inactivates the venom. Finally, octopuses have a venom that contains a tetrodotoxin, which inhibits voltage-gated sodium channels, resulting in limb or even respiratory muscle paralysis. Individuals should be admitted to an intensive care unit, and if respiratory paralysis has ensued, then intubation and mechanical ventilation should be performed. Unfortunately, there's currently no antivenom for octopus envenomations, so these individuals should remain closely monitored until the effect of the venom wears off. Finally, there are tick bites. The wood tick Dermacentor andersoni and the dog tick Dermacentor variabilis both secrete a paralyzing toxin that causes tick paralysis. Individuals often report a history of going hiking recently. The tick bite itself is usually painless and goes unrecognized, but typically a person later develops ascending flaccid paralysis. The tick should be carefully removed so that the head parts don't remain lodged in the skin. This is best done using tweezers. It's crucial to inspect the entire skin for ticks. Symptoms gradually resolve after removing the tick. However, intubation and mechanical ventilation may be necessary if respiratory paralysis has occurred. Alright, as a quick recap, mammalian bites include dog, cat, and human bites, all of which have the potential of leaving a polymicrobial infection. Specific organisms include Capnocytophaga canimorsus in dog bites, Bartonella henselae in cat bites, Pasteurella multocida in dog and cat bites, and Echinella corridans in human bites. Cat and human bites tend to have a higher risk of infection compared to dog bites. Wounds are cleaned and irrigated with high-pressure water. Primary closure is usually done for dog bite wounds, while cat and human bite wounds are left to heal by secondary intention. A wound gram stain and culture should be obtained if the wound appears infected, and empiric antibiotics should be given. Additionally, tetanus and rabies prophylaxis may need to be given. Snake bites include elapids, which are neurotoxic, and the vipers, which are hemotoxic. Antivenom is provided as early as possible. The two main venomous spiders are the brown recluse and the black widow spider. The brown recluse forms hemorrhagic blisters and may cause hemolysis within a few days after the bite. The black widow spider typically causes a target-like lesion and causes severe muscle cramps. Treatment includes antivenom. Hymenoptera, like bees, wasps, and fire ants, cause local skin reactions, allergic reactions, including anaphylaxis, and delayed serum sickness-like reactions. Treatment includes antihistamines for symptom relief and epinephrine in cases of anaphylaxis. Stings caused by sea creatures like stingrays, urchins, and catfish are treated by immersion in hot water, while stings from a jellyfish are treated by immersion in acetic acid or vinegar. Octopuses release the venom tetrodotoxin, which inhibits voltage gauge sodium channels, causing paralysis. Tick bites from dermacenter species can cause an ascending form of paralysis called tick paralysis. The mainstay of treatment is to make sure that all ticks have been removed from the skin.